Usually that's a discussion between the patient and the doctor. They really have to decide what's going to work best for them. Methadone is actually the generic name of the drug. And so methadone is one option that's been around for a very long time. Suboxone and Vivitrol contain either buprenorphine or naltrexone depending on the formula. Those are both brand name ones. So they're different delivery systems. Methadone you take every day at a clinic. Suboxone you take every day, but you can get pills to go home with. And Vivitrol is a shot that you take once every 30 days. Okay. That can be accurate. Suboxone can also be used much longer term. What people often don't recognize is that people who use opioids on a regular basis, like heroin or a prescription opiate, they need the drug at first to get high, but eventually they need the drug to feel normal because it messes with the brain chemistry so much. And so really, methadone and Suboxone are most effective, and Vivitrol are most effective at the beginning of treatment. They're to help the person not have withdrawal, not have cravings, because you can't very well sit down and talk to a therapist if you feel like you've got the worst case of the flu ever. Yeah. You know, the flu times 1,000. It's much more helpful if you're not feeling that way when you sit down to talk to the counselor or the therapist. Gotcha. To reduce those cravings, to make the person, I mean, we look at it as medication is just an addition to treatment, which is counseling, whether it's individual counseling or group counseling sessions, as well with a professional, as well as whether it's 12 steps or some other fellowship where you can maintain sobriety in everyday life. Methadone is another mood-altering drug. It can be addictive. So it depends on how it's used. So I guess it ultimately comes down to the medicine itself isn't necessarily good or bad. It's how the medicine is used. So if the person's in a program where they're seeing a physician who is educated in substance abuse treatment, is working with the person, they're also going to counseling, and then they can be weaned off methadone just like they can be weaned off anything else and eventually stop using it. Now, there are people who don't do that, who want to use it for life. And so that doesn't fit with an abstinence-based model. No, it's actually, it depends on the population you're talking to be honest with you. So people who are in long-term recovery, who did it on an abstinence basis, who might be really active in a 12-step fellowship, may have personal views that abstinence is the only way to go. There are others in the medical community that really look at opioid dependence a little bit different than alcoholism and some of the things we saw in the past, and recognize that short-term medication-assisted treatment can really help with the counseling process. Now, most physicians that work at one of our certified treatment facilities, they're going to recommend anywhere from 1 to 2 years on the medication, but they then want to get the person off the medication as well. So they view it as a tool to get them through treatment as opposed to a replacement. Right. But there are people who feel that it's just a replacement and everything should be abstinence-based. So it's really personal preference. Okay. It is in a way. I mean, there are people who will never reach abstinence, and those are few and far between. So on average, when I work with people in recovery, most all of them have reached a point of abstinence and have maintained abstinence for a very long time. I've met people who have maintained abstinence for 50 plus years. So it just really depends on the person. People have gotten there a lot of different ways. They've done it through 12-step groups. Most people are familiar with AA, NA, Alcoholics Anonymous, Narcotics Anonymous, but any 12-step fellowship, some of them it's been a religious experience for them, and so they feel that God cured them. And others, there are people who will take methadone for the rest of their life simply to maintain their brain chemistry where it needs to be. But that has to be a personal decision with the physician. And like I said, those cases are not the norm. A lot of it is just personal worldview and what you grew up with or what you're used to or what you feel is the best way to do it. 12-step fellowships preach abstinence. That's the ultimate goal, is abstinence, because the ultimate goal is not just to remain abstinence from a substance. The main goal is to change your life so you can live a happy and productive life. So somebody in recovery doesn't always focus on what they're staying away from. They focus on this new life they've created with new people and new things. So it really does become a personal viewpoint of whether you're completely abstinence-based, whether you think medication's okay short-term or long-term. But really from a medical, when we look at the medical research, medication-assisted treatment for people who use opiates is very effective in helping them get through those first couple years of treatment to reach abstinence and sobriety. That kind of goes back to that idea of when you first take the drug, you're taking it to get high, and then eventually you're taking it just to reach normal. Methadone is a way that you can stop taking the heroin or the illegal drugs and still reach normal. Under prescribed, here's a very specific dose, here's exactly how much you take. I've seen people who are on methadone leading absolutely productive, normal lives. They get their methadone dose in the morning, they go to work, they're parents, they're productive workers, they're soccer moms, they're baseball dads, they're out there with their kids, with their family, productive and doing what everybody does. We do pretty well here in Mahoning County. Across the state of Ohio, there's some shortage of doctors who will prescribe. Here in Mahoning County, we are lucky. Our major treatment providers all have physicians who prescribe Suboxone, prescribe Vivitrol. We only have one that gives methadone, and that's Meridian Healthcare. And that's because in the state of Ohio, it is very strict to open a methadone clinic. There are only a few in the state, and it's very strict to get that licensure. But those doctors who work in our certified clinics, it's about getting the person well for them. And so they are really careful with that dose. They work closely with the client. Some of the holes are, we do have physicians out there, and this is what people hear about and get concerned about the Suboxone. There are physicians out there who don't have to be hooked to a counseling group that simply prescribe it, that simply write the prescription every month, and that doctor's office appointment is considered the visit or the counseling session. That's not as effective for the person with the substance use disorder. It doesn't help them reach long-term sobriety and recovery. There's a little less accountability. They're not actually going to counseling. Just the drug itself, it's not a magic pill. None of them are magic pills or magic medicine that if I take this, I'm not going to be addicted anymore. They are all simply a bridge to allow a person to function at a normal level while they work through counseling and what's going on with their issues.